Facing depression head-on. Always feeling under the weather? Always not in the mood to be around others and have a good time? If you're suffering from prolonged sadness for quite some time now, you should face these bouts of depression and get yourself diagnosed by a psychiatrist. They're doctors who can actually help you out with your problem. Depression or prolonged sadness is actually quite common in the United States. Around 9.5% of the American population actually suffer from this illness. However, not all of them get to be treated. Thus, depression and its ill effects continue to be a burden to some individuals. This illness may seem quite simple to treat, but in reality, it takes more than a little cheering up to actually cure depression. Constant visits to cognitive behavior therapy is a must, as well as taking all the prescribed medicines that the doctor will ask the patient to take. None of these exactly come cheap, but the amount of suffering that a person is going through because of depression is enough reason already for others to start taking notice and face depression head-on. Depression oftentimes can easily get in the way of an individual's daily activities and his or her normal functions. One's zest for life can quickly and easily dissipate due to depression. And in place of an individual's sunny disposition is more or less a person who hates his or herself, having no self-confidence, trying to isolate oneself from the world and basically just not caring about living anymore. More so, a person suffering from depression isn't the only one who's going to suffer from this destructive illness. His or her loved ones are sure to follow suit. By seeing the individual grow through such rough patches, basically not caring about anything or anyone anymore, it's highly likely that not only will depression one's relationship with oneself but with his or her loved ones too. Fortunately, depression can now be cured, especially when diagnosed early. Depressed individuals can actually be treated through therapy and medication. Although it may be a bit costly, a person's good mental health is something that shouldn't be scrimped on. Cognitive behavioral talk or interpersonal talk are just some of the available psychosocial treatments that cognitive behavior therapists can offer to their patients. Both actually prove to be able to produce fruitful and positive results. Still, people tend to not recognize depression even it's right before their eyes. Being honest with oneself is key to being able to cure such an illness. Never overlook the various symptoms. Depressed individuals oftentimes exhibit uncharacteristic behaviors such as suddenly lacking interest in one's hobbies or other stuff that he or she usually enjoys, sleeps too much or actually aren't able to get some shut-eye, suddenly becoming antisocial, talks a lot about death or being a worthless person. There are actually a lot more other symptoms, but in case these already fit in your category or of someone that you know of, go to a reputable psychiatrist at once in order to see if the depression is still at an early stage or not. From here you'll be able to assess how the treatments will actually go. Depression shouldn't be something that people fear. Instead, people should just start taking charge of their lives and actually face this illness and fight it. Life is too beautiful a gift to waste, and if one will spend the majority of his or her life just moping around about every single little thing, then what kind of life would that be? Depression may not kill one's body, but it'll certainly kill one's spirit if you'll let it. Don't be a victim. Getting anxious over anxiety depression? A lot of people who are exerting too much of their brainpower usually exhaust not only their physical strength when engaging in various multitasking activities, they also tend to overextend their brains up to the point when it plainly needs some good old time for relaxation. A lot of busy people who seem to cannot fathom the idea of relaxing and taking the time off from work, as well as their worries, tend to actually start having nervous breakdowns, anxiety, depression, and all sorts of mental illnesses that can cause a person's sanity to go haywire. Fortunately, if you're one of those poor unfortunate ones who are unable to distress and is constantly worried and fussing over things, there are actually available cures and various treatments for treating anxiety depression. Anxiety depression is actually characterized by all sorts of irregularities and erratic behavior from the person who is suffering from it. This is usually due to certain stress triggers that may tend to easily cause a person undue jitters and stress. Also, a lot of people who tend to get easily nervous over stressful activities are actually prone to having anxiety depression. It's just a matter of being strong-willed when it comes to facing difficult and stress-prone activities. It may be pretty hard to overcome at first, but trying to be calm and cool in times of extreme pressure is what'll actually save your mental health from going totally downward spiral. When it comes to effectively curing oneself of mental illness, one must keep in mind that you have to be actually honest with yourself and assess what kind of depression or mental illness you actually have. Go to a reputable psychiatrist to get yourself diagnosed correctly as well as be able to get the right depression treatment for yourself. Here are the various types of depression. Manic or bipolar depression, characterized by sudden and extreme changes in one's mood wherein 1 minute he or she is in an elevated state of euphoria while the next minute, day or week, he or she is feeling to be in a personal hell. Postpartum depression, characterized by a prolonged sadness and a feeling of emptiness by a new mother wherein physical stress during childbirth, an uncertain sense of responsibility towards the newborn baby can be just some of the possible factors why some new mother goes through this. Dysthymia, characterized by a slight similarity with depression, although this time, it's been proven to be a lot less severe, of course with any case, should be treated immediately. Cyclothymia, characterized by a slight similarity with manic or bipolar depression wherein the individual suffering from this mental illness may occasionally suffer from severe changes in one's moods. Seasonal affective disorder, characterized by falling in a rut only during specific seasons, i.e., winter, spring, summer or fall. Studies, however, prove that more people actually fall into a rut more during the winter and fall seasons. And lastly, mood swings, wherein a person's mood may shift from happy to sad to angry in just a short time. But the type of depression that has actually been proven to be quite common among people is anxiety depression, which is actually characterized by the state of being overly anxious about things. Anxiety, a supposedly normal behavior that'll actually help a person adjust more to a certain stressful activity like first date jitters or a grueling exam the following day. Anxiety actually helps you get psyched up towards facing certain difficult situations. Anxiety, therefore, is actually a good thing. Anxiety depression, however, is simply the opposite, not to be easily dismissed as a case of the nerves. Anxiety depression is in actuality an illness that can be caused from the biological makeup of an individual, or in other words, a hereditary illness. Also, there are actually various types of anxiety depression, each having its own unique characteristics. Take for example generalized anxiety disorder or GAD. This kind of anxiety depression is a lot more complicated than the average anxiety depression, in spite of possibly being a day-to-day habit for those who suffer this kind of anxiety depression. Generalized anxiety disorder actually makes the individual quite more paranoid than usual. Anxiety attacks are more frequent, even absurd at times. They can even be anxious even when there's no apparent reason that calls for them to behave in such a way. People suffering from generalized anxiety disorder actually show a lot of symptoms, from lack of sleep to being unable to relax, getting tired easily, cannot concentrate on what they're doing, and even suffering from depression. This kind of anxiety depression is still curable, just a little work will actually do the trick. Consult a reputable cognitive behavior therapist who'll help give the individual the therapy that he or she needs to help him or she loosen up. Also, prescribed medicines are sort of a must to help these individuals battle anxiety attacks, help them calm down and relax.